Welcome to Effective Cannabis Conversations, the show where knowledge meets curiosity and stigma takes a back seat. I'm Debi Wimberly, your advocate for all things empowering, educating, and elevating in the world for better health. Welcome to another Effective Cannabis Conversation. Today, Angel Johansson, Michelle Diston, and Shaylee Johansson are joining me for a discussion where we're going to dive into and maneuver around medical cannabis and the workplace. So I know each of one of you can introduce yourself better than I can, so I will ask you to introduce yourselves.
My name is Shaylee Johansson. I am a full-time working mom of one. I do not own or operate any type of cannabis business other than the things that I consume in my own time. And I am more or less a test subject for my mom and everything that she's studying with her business, AJ Wellness. And I'm super excited to be here. I use cannabis products daily for a wide variety of things, but mainly digestive issues that I'm currently navigating through.
Hi, I'm Michelle Diston. My business is Cannawell with Michelle. I'm also part of the EC newsletter. With Cannawell with Michelle, I make products for people. I do coaching, I do consulting. I host women retreats, and I do online cannabis meditations. My main focus is helping ambitious women who are ready for change reconnect with their bodies and break free from old habits. Also have a day job, and so this is where some of this conversation is going to come into play, is being a medical patient and also being out in the workforce. So I currently use cannabis daily for chronic pain and focus for my ADHD, as well as my supplement from the antidepressants that I'm off. So it just helps boost my mood, puts me in a better state. I get more focus and I alleviate some pain.
I'm Angel Johansson, and I am a woman business owner, and I own and operate AJ Wellness Midlife Balance. And this is where I help women who are going through perimenopause and menopause, helping them to navigate through this with cannabis. And I do use cannabis products, and I make my own. As Shaylee had mentioned a little bit earlier, she does use my products, but mainly I use mine for sciatica and for insomnia. And I also use it for just for focus for during the day. And I also use it for some sort of type of almost like a vitamin, I guess you would say. So it helps my endocannabinoid system get everything that it needs.
And it's wonderful to have all of you here. My name is Debi Wimberly. I am the founder of the Effective Cannabis newsletter, and I have the privilege of working with Angel and Michelle on a regular basis, and then the honor of getting to know Angel's family, extended from that by knowing Shaylee. So this conversation we're going to dive into today is to really talk about how we work around being a medical cannabis patient in the workplace. And what are the conversations that are happening? What is happening to the patient and the acknowledgement of them needing this medication and how we move forward. So for each of you, let's start with when you applied for your job, were you already using cannabis at that time? Angel?
I've been a recruiter for the past 20 years until I separated in 2024. And prior to that, I wasn't using cannabis. It was something that I didn't use on a regular basis, or even really I didn't use at that time until 2021. And that's when I was applying for my last position. And I noticed that it was really complicated, and being in that type of a hiring space, and all the complications that could have come with it if I was to disclose or even been drug tested.
Do you mind sharing what state you live in?
I live in Utah.
And it is a medical cannabis state, correct?
That is correct. It became legal for medicinal use in 2018.
Do
Okay.
they do drug testing regularly at your workplace?
So in any workplace, some of them do, most of them do, honestly. But it doesn't ask you, do you use any type of recreational drug? It will just usually on the applications, it'll ask that you agree to a drug test.
And how about you, Shaylee? When you applied for your job, were you?
I was. I don't remember seeing that question on the application, and typically if I am asked that question, I usually leave it blank. I don't really feel like it's anybody's business. With my workplace personally, I was pretty worried that they were going to enforce a drug test on me when I did apply. But in the past and with this job too, I had and was prepared to, get around it some way. So I don't like doing that, but you know, it's very complicated. I don't think it's anybody's business, but at the same time,
If you don't mind, can I ask, do you have a job where you use machinery where they might say you need to be drug tested?
so I do not, but I manage a team that does.
Yeah, for me, it was no application, just a resume that I submitted. And on my resume, I had all my credentials, my current credentials as a cannabis coach and some of the different things that I have picked up in there as skills. So they already knew that I had this background coming into this job. And we're a small town, so they've been to the market, they see my products, they know the stuff that I'm doing. I was never asked per se if I use drugs or if there may have been assumptions that I use cannabis, but not in a medical cannabis way, right? Conversations like, oh yeah, sure, I've smoked this or I've tried that, but it was more recreational conversations versus like how would you use it medically. So my workplace knew about my side business, what I'm doing, my credentials, but maybe they didn't realize that I'm using daily cannabis.
Yes, I was just going to ask you, were you comfortable with putting that on to your resume or your LinkedIn or wherever you threw your resume out?
I was nervous as hell. And I was like, but if I don't stand up for this, and it's just my credentials, it's what I do. And if I'm not solid behind what I do in every space that I go in, then I'm not conveying, the importance of it. So I really did have to check in with myself and with my husband. Like he's like, you're putting that on there, and I'm like, I am putting it on there because I have to stand for this. And I'm in Canada, yeah, so it is a little I don't know, cannabis conversations are a little more free and open. Everybody's able to get cannabis, age of majority at any dispensary. So yeah, it might be a little different story there. No talk about being drug tested or anything in most businesses, I would say, around here.
Is that something that has ever happened in Canada? Drug
Well,
testing?
I wouldn't say that. Like for stuff like CN, right? Like operating trains and other equipment and pilots and stuff like that. They have operations that, of course, they don't permit. I think even recreational cannabis use, but I'm not exactly sure how that goes. And I have some more responses about that later when we get
Okay.
into it. But
Right. And Shaylee, I'm sorry, I did not ask you if you were living in Utah also, or if you live somewhere else.
Yes, I'm currently in Utah.
Okay, so at least we kind of know where the policies are. I'm located in Phoenix, Arizona, which is recreational and medical. So how clear or unclear have workplace policies been regarding cannabis use in your experience in your jobs? Michelle?
Well, the one mention of even alcohol or drugs, I put it in the same ones, is just cause for termination is alcohol and drug abuse on the job. Nowhere else do they really mention anything else. And of course, when I read that, I just dismiss that. Like, of course, I'm not abusing drugs on the job, right? But nothing about, obviously, nothing about medical cannabis. That's still so new that, you know, we want to get this going in these places, starting to have those conversations that more people are using cannabis medically, whether they know it or not, and some that do know it and are using it that way, that people may not be protected at their workplace, that, you know, as soon as they see that you know, whether it's CBD or THC, it still just kind of falls under cannabis. And, you know, places that are uneducated about medical cannabis might see that as drug abuse, and then it could fall, and it could be cause for termination.
Well, and that brings me to, do you really believe that using medical cannabis should be classified as a drug? Is it a pharmaceutical or is it a drug? I mean, I know it's not a pharmaceutical, but I mean, when we talk about this, you know, we classified dangerous drugs, and we know that that's not cannabis. No matter how we shake it, we know that's not true. It's not a dangerous drug. So when we have these conversations and look at the policies in the workplace, do you see that it should be classified as a dangerous drug or a drug that you should be avoiding when it is your medicine?
Well, definitely not, but I do see it being still complicated, putting it in a policy, and not being able to differentiate between what's medicine and what isn't, right? When I advocated for myself in my workplace that I use medical cannabis every day, and they're like, okay, we'll just use the medical side of it, like referring to CBD, right? Or other non-intoxicating cannabinoids. Not that they had that language, but I'm like, it doesn't work like that. You don't understand, right? THC is still medicine. And when you have a therapeutic minimum dose that, you know, you're not impaired, but you're getting the medicine that you need, there should be a way to differentiate that in the workplace.
And that's hard for us to determine. We can't do that through testing, go lab testing. We cannot do that because you could have used cannabis 6 days ago and still be testing positive for having it in your system. So, and you're not impaired at all. So I think that's what makes this a challenging conversation. So Angel, have you being, and I think you talked about this a little bit, about being a recruiter and the policies around cannabis. Can you share a little bit about what it's been like for you regarding cannabis use and the policies as a recruiter?
So really, when it was legalized medicinally, it was really unclear. There were some candidates that would ask me during the interviewing process, do you drug test? And then they want to go into their history, and I have to stop them there because I cannot, you know, as a recruiter, we can't be biased. If I offer them the position and if they ask me the same question, I tell them the same thing, and we just say, let's just have you do the drug test and let it just see, let the system do its thing. Also times where people would disclose to me in the onboarding, so they've already been hired, and we're going through the onboarding, going through the policies and procedures where it just says, you know, don't use drugs or alcohol. But then they asked me, well, what about cannabis? I'm a medical cannabis card holder. I didn't have an answer for them because it was never outlined. It was never brought up. It was never told to me what, you know, what those policies are specifically for cannabis. And because there's such a stigma around it, I felt that I could not go up to my higher ups and ask them and let them know, hey, this person is a medicinal cannabis card holder, because of that stigma, I didn't want them to make assumptions. And even when I was trained, and there was nothing in the policies and procedures. And so I would just tell them, just as long as you are not using before or during work hours, and especially do not use something that you have never used before, because you don't know how that is going to affect you and how it's going to affect your work. So just wait until you're off work and use it then.
In one hand, but the people that are using cannabis every day, all day for their medical things, you can't just say, well, don't use it before and during work, because people need it at those times, right? And so then where does that leave that person? Like, well, now I'm going against, policies and procedures, and I feel like I'm lying or whatever, right? Because they need it.
Exactly. And that was the most difficult thing that I had to do.
That has to be hard, being someone that understands cannabis, that has had lots of training to be certified and to help people learn about cannabis. It has to be hard to sit there and not be able to give them some advice that would guide them. I would think that this is one of the problems that probably exist in most jobs today, is that there is no policy. They haven't rewritten their company policies in years to upgrade it to include stuff as we've progressed in medical cannabis. For me, I couldn't go to a job and do a daytime job and say I can't use my medicine, because having lung disease and chronic pain, I can't just use when I first get up in the morning and then not use it again until the end of the day. That does impact my quality of health and would prevent me from being a healthy person. So because cannabis has become my full medicine, has replaced 25 pharmaceuticals. So thinking that that's a correct way to handle this is not appropriate for all individuals. If you're just a recreational user and you're using it for relaxation like you would after work, like a wine or a beer, that's one thing. But when this becomes your medicine, this is really an important conversation that we need to be having. So Shaylee, do you know if there's any policies at your job around this and what they say?
So my employers really blow my mind, to be honest. When I did apply, and there was the employee handbook and the policies, procedures, all of that. A lot of it did fall heavily on the technicians, and like, hey, you guys have a job where you have to be alert all the time. If anything happens, then we are going to drug test you. And that will involve an alcohol test as well. So, when they do their testing, they do like the 3 full 60 all the way around, see what, actually happened. But, I have a tech who was very open from the start about his cannabis use, and he is a medical cannabis user. He has a card, and, he applied and presented that to them. And like I said, when I say that they blow my mind, they're a very religious company, and this is very frowned upon in their religion. So for them to be very lenient and be like, okay, no, we understand that you have these issues, and we understand that this does help you. So please do what you need to do, but please know that, if you do anything wrong on the job, or if you do mess up in a way where it causes harm, or it's a significant screw up, then yes, we are going to test you. And, if we learn that you did use it irresponsibly, and or, during a time where you probably shouldn't have, to cause this accident, then yeah, you probably are going to get terminated. I wasn't very open about my cannabis use until I got really sick and I was put on short-term disability. And I don't know how it happened, what way or the other, but in one of the doctor's notes, it had mentioned that I had used cannabis, and they had to forward that over to the short-term disability insurance. Like, they had to forward over a lot of my doctor's notes and stuff to prove that I could be on short-term disability. And that note had included that I used cannabis. And so I had immediately gotten a call from the nurse, and she's like, Shaylee, like, they're requesting these documents, but on one of these documents, it does say that you use cannabis. She's like, if we send that over, then there's, might be a chance that your employer could see it or, something along those lines. Do we have your permission or would you rather us revoke it? And they're like, but if we don't send them these certain documents, there is a chance that you might not get your full allotted amount for disability or, it might get denied. And so at that point, I was like, you know what, just go ahead and send it. I called my HR lady and I just broke down in tears and I was like, please don't fire me. Like, I'm sorry I didn't tell you this from the start, but I use cannabis daily, but I don't ever use it, during the job or anything like that. And I, gave her a spiel on what was happening with me and, why I used it and all of that. And, she, at the end of the conversation, she's like, don't freak out. She's like, wouldn't even be able to tell in a million years. She's like, you're great at your job. She's like, again, we're going to tell you like we tell everybody else who's open about this. As long as you don't screw up significantly, you're probably going to be okay. And so, after I came back from being off a short term, the only thing that they did ask is that I would be open if I was partaking again. And so I did let them know that, I would be partaking, but I did let them know exactly what I do every day too. I wake up and this is what I take. And I've told them I will be implementing this tincture in my afternoon tea that I have at work every single day so these issues can stay at bay. I promise I won't get lucid from it. And if you ever notice me doing so, you can tell me and we can address it from there, or you can fire me, whatever you're comfy with, because you've outlined the rules, right? Like, I'm not supposed to get crazy on this. So, and I've been back at work for a couple months now and it hasn't been an issue. And I'm really thankful for them and their understanding. And so, like I said, with them, their policies aren't very clear at all. They don't really have it specifically outlined, but, I think they're very understanding of the times. And
Yeah, that's an interesting take because that's not normal what we see in businesses today in general, is
No.
that willing to be open to seeing that you use it and that you being honest about it and sharing exactly what you do. I think that's really important. Just same thing as I think it is with your doctors, being really open about what you do and how you use it, but then that they're willing to, on any level of of the employees, what they do, if they use it responsible and don't see any indications of any problems, they're allowing them to continue to do that. That's the correct policy, if you ask me.
Yeah.
It should be written into the policy. There needs to be a policy update for all companies to handle this. Whether it's happening or not, I don't know. But I think there has to be some acknowledgement that this is what we're living with today. And when we know how many people are dealing with serious health conditions today, we need to be able to realize that cannabis is bringing a quality of life to a lot of people. And if they didn't have access to cannabis, they'd be missing a lot more work. This is one of the things that drives me crazy, is that you want your employees to be at work. And if cannabis is that thing that gives them the ability to be at work more every day and not lose time, it saves the employer a lot of money. So, I mean, there's
right into my story of why I got my first warning at work for consuming cannabis to close on the property. But yeah, I was very distracted with pain at work. I just could not focus. And so in order to be productive, I went outside and I thought I'm gonna go for a walk. I'll have 2 puffs for pain and come back and resume work. And I didn't think anything of it about, not walking further to light up so that I wasn't on the property, because I was just, I just wanted to get rid of the pain. And that's where, I accept that maybe I shouldn't have on the property. And so I took that warning, like, yep, I will not consume on the property. But we do need to acknowledge that I'm a medical cannabis patient and that I do have cannabis in my body every day, and that I'm fit to work. And so from there, that's where I initiated a proposal to actually work together if they wanted, or, things to consider for putting in place a workplace medical cannabis policy. I had both the employer and the patient in mind. So making sure to protect the patient, that they have the right under the Human Rights Act, that they can advocate for their own medicine. And I made sure to include employers' rights, that we need to still have a safe and efficient workspace. So I haven't heard anything back from them, but I just hope that that comes into consideration and something to think, at least protecting myself in that space and possibly future and other current medical cannabis patients.
I also think that it's important to point out that everybody has what's a state or government issued medical marijuana card so that they can consume. So your state is saying that you have the right to do this because you have a medical condition that they classify as requiring that. So I think that the jobs need to start, or employers need to start recognizing that that is also a thing.
The other part to that, though, is patients don't have to disclose their medical conditions to HR or to their supervisors. And you shouldn't ever have to be asked about that or anything either. But there should still be a way to represent yourself, that it is, and just having a medical card, you have to go through those things anyways. You have to have a condition that it works for, and they give you how much you can have a day or whatever it is on your medical marijuana card. For us, just our prescription is, oh, you have a condition that qualifies, here's 5 grams a day. And like, it's not like it's telling me you can only have edibles, or you can only have an oil, or these cannabinoids. It just kind of leaves it all up to people. So that makes it harder too, to just go call your HR. And I'm glad that you did that and it worked out for you in your workplace, and you have that relationship where you can talk about it. But when there's different things that people don't want to disclose, that's not always the option. And we still need to have a way that those conversations can be had, protecting client confidentiality, patient confidentiality, and still be able to express it at work, that it's a valid reason. I think just having the card itself should be the valid reason, right?
Agree. And Angel, you can probably talk to this a little bit about working as a recruiter and what you can and you cannot ask, and why you can't ask those questions.
Well, it's just like, are you married? Are you single? Do you have kids? You cannot ask those types of questions. Now, kind of like on the flip side of what, Michelle was echoing with what Shaylee had said about her employer being okay with that. Shaylee didn't have to disclose that, but she did. She wanted to be honest about it. Now, the last position that I worked at, my supervisor, who was head of HR, she wanted to be in everybody's business. And that was not right. And that is the reason why I never went to her, because I knew that she would just shut it down. And that person probably wouldn't have had a job because of that, unless they could tell her everything. And they don't need to tell her all about their medical history or anything. I mean, you're not even supposed to disclose why another supervisor is off, but that person would tell, because they have XYZ. Why are you even telling me this? So, but no, legally there are a lot of things that you cannot ask employees, candidates, anything like that is correct. And we even go through specific trainings for these. You cannot be biased. That's why you cannot ask certain questions. But yeah, exactly.
Shaylee, you had your hand up there. You had something you wanted to add in.
Yeah, so just piggybacking off of the honesty and stuff, I am a huge open book. I mean, if one of them probably would have come up to me and be like, hey, Shaylee, do you smoke weed? Be like, oh gosh, you got me, guys. I do. Please don't fire me. But when it comes down to it, I think a lot of people have a lot of issues that I have, especially with the digestive system and stuff. So when I tell somebody what I have, it's not more so of, oh, I'm just going to spill my guts out to you and tell you all my issues and, I want you to feel sympathy for me. It's more of a, yeah, I have what you have and this stuff is helping me here. I know you're like super religious, but try it. It might help. You know what I mean? It's more of an educational thing. It's more of a, you know, I don't consume pharmaceutical drugs because this helps me. Or, I do take one pharmaceutical drug and then this is a booster for it and it helps it in so many other ways. You know what I mean? And so, like I said, it wasn't more so like I feel very comfortable with my HR. Don't get me wrong, I do. But even when I was working in property management, I probably wouldn't approach it any other way. I probably would have approached it the same way, even though I know I probably would have been fired on the spot with them, right? I mean, I totally get it. But, for me, like I said, for me, it's not more so of, I don't care what people know about me. I don't care if you know what my medical issues are. It's more of a, I know that a lot of these are super common and mine are just kind of off the wall and on a different dimension, but this really helps me. And, I can actually come to work on it and you shouldn't be scared of it. And so if any of your other employees come up to you and ask you if it's okay, have a conversation with him. I would rather be that open bridge for other people than still being that person shoving fake pee in my bra as I'm going to my drug testing station and hoping when I pop the cap, nobody hears it, Sorry. But that's my approach on it. And I totally understand that people don't want to, you know, discuss what they have. They might not be comfortable with it. And that's I understand that 100%. But I do feel like there is some, I don't know, there is some positivity and outreach and just kind of shedding a little bit of light because a lot of these people don't have that light in any way, shape, or form. They read it off of tabloids. They don't get it from a one-on-one person. And I can't even tell you how many people come up to me like, oh, you don't ever seem high? Like, yeah, well, because I use it medicinally. I don't use it to get baked.
Right. Well, and I think you can say that about all of us sitting here right now. We all use medical cannabis.
Yeah.
So let me ask you, do you think that workplaces should have someone in and educate HR and employers on medical cannabis and how it works within the system and how it is no different in reality to using a pharmaceutical to address certain medical conditions? Do you think that would be something that workplaces should be more open to? We'll just go around the table. We'll start with Michelle.
Definitely. I even kind of put a little like clear, concise, little practical information pamphlet idea. And the things that I would include on something like that. Like I think all employers should just have this little pamphlet in their hiring package kind of thing. Or just but employers need to understand the basics of medical cannabis, what it is, how it works, methods of use, right? So like easy stuff, how it interacts with the endocannabinoid system, right? Like, so quick little education. Common conditions that employees may use cannabis for, including chronic pain, mental health, neurological disorders, sleep disorders. That way, like, you don't have to even disclose your conditions. It's just, oh, these are some of the common conditions it's used for. Workplace rights and responsibilities so that employees know their rights, employers know their rights. Cannabis and workplace safety, knowing the difference between impairment, it's not the same as use. Knowing the signs of impairment, maybe like put a little list of what that looks like, maybe slurred speech or poor coordination, delayed reaction time, things to look for impairment. Making sure the workplace has clear policies that balance safety and inclusivity so that it's still recognized as useful. And then creating a supportive workplace, stuff like open conversations, education sessions, policy updates, making sure policy reflect evolving cannabis laws, and yeah, so I think if people had a one pager with some of that information on it, as all employers, it would open the conversation at least, right?
When we think about the workforce, It's in every job. It's every kind of job. Doesn't matter what anybody does. Anyone in any job could be using medical cannabis. So it's every type of workforce that you can think of that could be engaging in this conversation or needing to engage in this conversation, because it could improve the work of their employers, of the employees, and bring them to the job more often if they're getting to have access to better health care and better medicine.
You know, I can only speak for half of the company, to be honest with you. I don't talk to one of the bosses hardly ever at all. So I don't know if he's as cool as the ones that I have up here. But you know, I definitely think that that would be something that they'd be interested in for sure, just to kind of get a little bit more knowledge. Um, I think that it would definitely crush quite a bit of stigma in states like these. Um, so yeah, I think that my work would be open to it, and I do think that that is something that should be implemented across the board, just for educational purposes, for sure.
That's going to bring me to you, Angel. And so when you end up hiring someone and onboarding them, bringing them into the company, there's a ton of training that they usually have to go through just to be onboarded into the job. Is that correct?
Yes. that
The
is
policies
correct.
of the company and all that stuff. Do
Yes,
you see
exactly.
where this would be something for anybody that's coming in, would be a good educational moment just to talk about medical cannabis and the role that it plays in the quality of life of employees, that so the managers understand it and the employees understand it? I know we don't do this on pharmaceuticals, but I'm just trying to understand how we can bridge this gap.
Yeah, absolutely. I believe 100% that that should be brought into any company, especially in the US, where certain states have not only recreational, but also medicinal. You know, because just like any other prescription, if somebody's under a doctor's care and that medication does not impact their ability to work safely or effectively, there should be room for accommodation. And I think that having that information, I think that all employers, managers, supervisors, everyone in that type of a role should absolutely be educated on it, just so they are aware that yes, this is a medication. This is someone's life. This person needs this and able to be able to perform or to be able to work. So yeah, I believe that 100% it should be brought to any employers.
I think it's the difference between stigmatizing someone and supporting someone. Just having that knowledge behind you, like, oh, I never even thought about cannabis being used medically. I've only heard about it for people getting high. And so just changing that mindset, but with, you know, a little bit of education. It doesn't have to be explaining in depth what the endocannabinoid system is or what all these other cannabinoids do in your body, but just that be aware that people do use this for medicine and that they have a right to use it, and know your rights as an employer to support them.
And I think when we have these conversations, it opens up the door for people to understand, no, it's really helpful. It's not harmful.
Yeah.
Yes, it could be maybe used in a way that's not successful for some people. But in general, most people that are using medical cannabis use it in a way that is helpful and gives them a quality of life. We take it seriously when we live with these chronic health conditions and we haven't been able to get some kind of support or help through pharmaceuticals. When we can transition to these and we see our quality of life improve, we take it very seriously. We don't just, it's not just fun and games for us.
Mm-hmm.
So, you know, I think it's important just from that perspective for the employers to understand that we do take this seriously. And it is engaging with the system within our body that we all have. And it's why it works. So thank you for that. So have you personally witnessed or experienced stigma around cannabis use in your workplace? And if so, how did it manifest and how did you handle it? Angel?
Is stigma? I think just with my supervisor, just her personal feelings that she has just kind of offhandedly talked about. And so I just kind of, I didn't show any type of reaction. I don't know if she was expecting a reaction or not, but yeah, I guess I did. I have witnessed it, but I mean, not to the point where it was directed at any one person.
So it's a little iffy to say if there's stigma, because I'll have to say, like, my supervisor, above them to both have bought products of mine, and whereas when I got disciplined at work for smoking on the property, I still don't think it was a stigma issue as a we're following policy issue. Things with Canada being so open about cannabis, like recreationally across, people talk about it a lot, and there's less stigma in it, but again, it's still uneducated where there's no stigma in using it recreationally, but they don't realize that there's also the medical side of it, right? Like, and how that fits in. But yeah, I wouldn't say it was a stigma issue, but it was we got to follow policy issue.
So do you find that Canada accepts recreational really well, but doesn't really embrace medical?
Definitely. It's so much harder to even access medical cannabis, even though some of the recreational stores sometimes stock CBD products and stuff like that. It's rare that you'll find CBG. You won't find the actual flower to make your own medicine from that. You have to really go through back channels and have your medical card and use a medical store or online or store. But the medical part is not talked about. You're not allowed to talk about medical benefits in the recreational stores, which I still feel is just so backwards. Yeah, everybody has access to high THC all across Canada, but it's really hard to get medicinal cannabis.
Well, I think we see high THC all across the US as well. That's not just Canada.
Yeah.
So I think that's just the rate we're going because it is moving towards more of a recreational acceptance versus a medical acceptance. And we're here to talk about it from the medical side, that we understand this is medically improving quality of life of people. And we need to make sure that our employers, our doctors, everyone involved understands the power of this for us in improving and taking care of our health. So, yeah. So, Shaylee, I think I might know the answer to this, but have you experienced any stigma within your job?
So I have experienced some stigma. It wasn't towards me. It was actually towards my other coworker who does have his medical card. Neither me or him are very open to any. We're both managers, so we're not very open to the employees that we have underneath us. But I did run into in passing where I don't know how the conversation had stemmed, but this employee had just started going off about how he thought it was the worst thing in the world and that he couldn't understand how anybody could ever be on it or even try to partake in it, and that it ruins so many people's lives and that they're lazy and everything else. And my coworker is just sitting there going, okay, well, I have my master's degree and, promise I'm not lazy. And so he fought back to an extent without, personally conveying that he partaked. But, he did, say that, it could be, he does see it used for amazing things, and it really does help out people when it is used medically and not, recreationally, days on days on days on end. And, he tried to explain the difference because I don't think that that employee really had any type of mental shift of medical versus recreational. I think that we're finding that everywhere. So, after that kind of boiled down or whatever, and the employee had left, I went back in and I asked my employee and my coworker if he was okay. And if you had any questions or anything that I could help with. And he's like, no, he's like, it just makes me feel, he's like, I don't ever want to feel bad. I feel bad that there's so many people that feel so badly towards it. He's like, I don't know how to fix it. I'm like, well, it's like, can only start where we're at, and go from there. I told him I did a great job trying to explain the difference, but then again, you can't beat a dead horse, so.
Yeah, well, this is why these conversations are important, and we hope this continues to happen. And this is going to bring me to my next question. Are you open with anyone at your job that you do use cannabis medicinally? And how do those conversations go? And where do they take place? We'll start with you, Shaylee.
So I do, besides my two bosses, my coworker, one of my coworkers knows, and then one of my techs below me, he knows. The only reason my tech knows is because my laptop bag had fell over and my tincture bottle had fallen out. And he was like, "What's that?" Picked it up. I was like, "Oh, that is mine." And he's like, "Oh, that doesn't look like a maple leaf on the label." And I'm like, it's not. But he was like, don't worry, I'm not going to tell anybody. I used to. And I'm like, hey, well, I use medically. So, I don't partake heavily in the after hours recreational activities. And he goes, I do. I'm like, great, keep it at home. Don't go crazy here. And then my other coworker, he had just confided in me because he was really scared after he had applied and had, gotten the drug test back and it came back positive. He was just really scared that they were going to come back and retaliate. And he confided in me and we just kind of sat and talked. But other than that, I really won't bring it up with anybody out of the blue. If somebody sparks conversation about it, then I'll definitely jump in. And I think everybody at work does know that I'm pro cannabis. I don't have any issue hiding that, but for more personal conversations, it's not very open with anybody in my work. It's very select few, and especially if somebody comes and confides in me or is scared about something, I'll talk them through it. But just those two, four, I guess, with my bosses. But me and my bosses, we don't talk about it very often.
You just made them aware of it.
Yep.
So when you say everybody knows you're pro cannabis, can I ask you how people know that you're pro cannabis?
I've got stickers.
Okay.
I had a little cannabis webcam Zoom call thing on my calendars and stuff. So everybody knew that I was not available from this time to this time. And, I've mentioned my mom and what she does and stuff. So, like I said, when we have those conversations, I'm very, open about my feelings on it. I don't really dive into my personal use per se, but like I said, if the conversations are spread, I'm like, oh, I know a lady that does this and it helps this. And, that's kind of where it'll feed.
I think that's kind of interesting that you have stickers that you use in your office on your calendar just as a way of, that could be a conversation starter.
Yeah.
Just a way to, just ask about cannabis, not that about your use, but just, what is that leaf on your calendar? What does it stand for? That kind of thing. And I hadn't really thought about how do we engage in bringing this conversation to the office just by showing that we're pro cannabis. This is beyond being a medical cannabis patient. How are we showing that we're pro cannabis? And I think that's another important conversation is that we should be having is that, we believe in this plant, so we should stand up that we are pro cannabis. And how can you do that? And I think stickers and little things that you said are really a kind of a cool way to bring that in. Angel? Have you ever used anything within the office to show that you are pro cannabis?
No, but I personally have not, but I had 4 or 5 coworkers that knew. Again, they felt comfortable enough to talk to me, so they would come into my office, we'd close the door, and it might have led into that conversation from another conversation. So, but about 4 of those people, and let's just say 2 of them were supervisors. They, not my higher ups, but they are in a leadership role. They asked me for some of my products, and but yeah, so they knew that I was pro cannabis, and they knew that I got my certification and that I was getting another certification. And they were just so interested, and it just sparked a lot of conversations, which were really great conversations. And I was able to share information with them that they never knew. And that made me feel good at the end of the day.
Michelle, how about for you and your workplace? Are you having conversations around this, and are you openly letting people know you're pro cannabis?
Yeah, it was interesting, like I said, with my resume, having my credentials on there. When I got the call that I got the job, the principal was saying, I don't know if people are more excited about having you come join us, or that they can ask you about CBD and stuff. I'm like, okay, right on. So if people know, and half of them have my pain salve, and I brought CBD infused croutons to a potluck, and so everybody had that, and yeah, people definitely know that I'm pro cannabis, and will come and talk to me here and there too, ask me questions, and yeah.
So employers often cite that safety and productivity are a concern, and we've talked about that a little bit. But in your experience, have you, and especially with you, Shayla, since you work with people that use machinery, have you ever seen it or witnessed an event that you would say that's very concerning, and then it could actually pinpoint to that they did use cannabis, or was it something else? And are these concerns valid, or are they overblown?
Yes. So I can't say that there has been a specific incident where cannabis has been the one to be blamed. Um, I do know of one incident where cannabis was involved, but alcohol was more heavily present. I think that was more so the culprit. They probably were partaking in both that day. But when it comes down to it, after the investigation and everything, it was more or less the alcohol, especially with what was found on site. The only other incidences that I can recall were more so firing on the spots, because a couple of our techs were smoking openly at one of our clients' house. But other than that, ever since I've been with the company, at least, and from what I've heard, I haven't heard of any other incidences that involve cannabis to be blamed. I do believe that the concerns are valid if people partake in more than they probably should if they are using it medically during the day. But like we were discussing, as long as it's more so like you are taking what you need and you're not overdoing it, especially for your job and what you're able to do, it shouldn't be an issue.
Agreed. So Angel, as a recruiter, I know that you had employees that needed to run machinery, that this would be an issue. So can you ever think of a time where you could say that cannabis was a culprit in causing someone to not perform their job well, or to cause harm in some way, or is it overblown?
So I think that it's overblown. Now, but it really just depends on the setting, really. I mean, in my 20 years of recruiting, I've hired anyone from a regional manager to production workers. And if someone's job involves operating equipment that could either injure them or themselves, then yes, I think that they should take precautions. Employers should take precautions. Safety should always come first, but I cannot recall a time, even knowing that some of my employees were running operating machinery close, well, not operating the machinery, but close by moving parts of machinery. I've never heard of anyone getting hurt, but just using that common sense and being aware of your surroundings and making sure that, being intoxicated, that should not be, in a workplace, especially when safety is concerned.
So I have a question about that with people. Like, I know that people who have worked with a coach, a cannabis coach, have found their targeted dose where they know that they're not impaired because they've tested it at home. They've tried different things. They found their, okay, that's a little bit too much. We're coming back down. Now we're at the ideal dose. I know I don't get impaired with this amount. How many people out there that don't have a cannabis coach actually know how to use their cannabis in a medicinal way to avoid impairment? That's a
Good question. I don't know how we answer that question, though. This is the thing that we find. Most people don't know that there are people that are cannabis coaches or cannabis specialists that they can call on to learn this. This is where education is really missing.
I think it's so important that people understand that there is a way to do that, and it's not just get your card so that you can get away with having cannabis on you, but it's get your card and then get a coach to find what you need exactly. One, it saves money in the long run, and two, you'll just feel so much better, right? When you find exactly what your body needs.
I think that it's really important to understand that everybody's different. So what Angel uses, what Shaylee uses, what Michelle uses, what I use is all different. And we're all treating different conditions, but I think probably we're all using it for some form of pain and sleep. But I guarantee you what we're using, each one of us individually, is probably different at a different dose and a different mix of cannabinoids in our system. And that's where I think the education becomes so important for our employers to understand, is that each person has what I call a sweet spot and understanding their medicine. And that's why it's important that employers kind of have an understanding about the education of cannabis and why it's so important to understand their employees with it.
Definitely.
So how should employers handle employees with medical cannabis prescriptions? We've talked about this all over the place. So do you have suggestions of how you think that we could improve this process? And should it be treated similar to other medications like pharmaceuticals? Or is this a unique consideration? Angel, we'll start with you.
Employers already handle medications all the time, right? I mean, because usually if something does come up in a drug test, like if it is an opioid or whatever, it's disclosed to the employer. So they already handle that kind of stuff. This should be no different, but with the understanding of its unique legal and the perception challenges that cannabis brings. But I think that it should be treated just like any other type of prescription. It is a prescription prescribed by a doctor, same as any other prescription. Okay.
Should you be treated differently because you're a medical cannabis patient with a prescription versus somebody that's, let's say, using insulin?
It's just like any other life-saving medication. I mean, if it is something that helps you, I mean, just like if you're a diabetic, if this is going to be treating a specific medical condition that you cannot live without, and you of all people, Debbie, know this, I just think that it should be treated just like any other prescription, because you do have a medical cannabis card. If that state has cannabis as legalized for medicinal use, then
I have another question too. Like you keep saying, because they have a medical card, they have a medical card. I know in Canada, we don't necessarily have to have a medical card because we all have access to the dispensaries regardless. And sometimes they have CBD drops or gummies or whatever else, or even THC smokes. It's still considered as medicine. So what if people don't have a medical cannabis card, yet they still identify as being a medical cannabis patient?
That's what we run into in our state because we have a medical program and then we have a recreational program. Since we've gone recreational, most people are opting out of getting their medical card.
Mhm.
And I still see the benefit of having a medical card. First and foremost, it informs anyone that I deal with that this is my medicine. And I want people to understand that this is my medicine. By having that medical card, that just automatically puts that to rest for me. And they can't say, well, you're just using it recreational, because that's what happens. So, but it becomes an issue because there's a lot of people that have dropped out of the program because it costs $250 every 2 years to get a medical card. And versus you can just go buy in recreationally and get the same stuff. Yes, you're going to pay more taxes and you're going to pay more for your product, but it's a lot less hassle. So people opt to do that. But I do believe there's a really important reason for you to have a medical card, because I think it's important for us to show the value of it as medicine and to accept that I want to advocate for this as medicine and it be seen as that. So that's the reason I keep renewing my card. But we can't, and that's why I asked this question, because what if you don't have a medical card and you are using it medically? How do we handle this? This is a lot of the conversation that makes all this muddy.
In Canada, we don't have a nice, pretty little card that you can carry in your wallet either. When you get your cannabis card here, it's basically just a prescription and you have it sent to the dispensary of your choice where you're going to shop from. And so we don't even have that physically. I can have a copy of what my prescription is, which is my 5 grams a day and that's all it is, right? A paper that says you're authorized. But yeah, we don't have a card, so that's not even really doing anything for us either. But we don't have to pay for it either.
When we start talking about the prescriptions and, making sure that you have a coach and a doctor and, you're right, it all does get super muddy and it's like for me, it's really hard to even answer that question because I don't view cannabis the same way that I would view, I don't know, like I don't even view cannabis as a drug or like, I don't know, like it's definitely a medicine for me, but when I think of medicine, I'm thinking of pharmaceuticals or cough syrup or something like that. So that's where it really gets hard for me because I can go to my doctor tomorrow and be like, hey, can you write me out a statement and sign it saying that I use cannabis medically and I have to, and we're just all going to be okay with it, and he'll do it in a drop of the hat, right? I mean, I could go and shove those papers to the dispensary and show them in the face that I'm blue. But without having a medical card, it's really hard and it does get pretty dicey when you're not in a state that views it as, acceptable. And then when it does come to employers trying to differentiate it between recreational versus medicinal, and it's like, man, you might have a really good, person that's worked for you for 10 years, and they also, use cannabis regularly, but they are definitely not going to go get their medical card. So at the end of the day, are you going to fire them because they won't get their medical card, or you keep them on knowing that they're still really good as an employee and, that you don't have to enforce certain things, but then that's where we get into fair housing and all that fun stuff. So that question is really hard for me to answer. I do think that it should be regulated more in the sense of a prescription, but then again with that too, it gets very difficult and you're not going to have a lot of people, I don't know, as on board, I feel like, unless the cost comes down, it is more worldwide accepted and there's not a lot of stigma because I mean you can view it the same way as any other drug. I don't know. That's a hard question for me to answer. I do think that it should be more regulated as a prescription, but I do think that it's going to be very difficult to even get it to that point.
And I think you're right. It's going to get difficult because we don't want it to be in the hands of pharmaceuticals, or I don't. I still want to have the natural plant. I want to have access to it. But I want it to be known that it is my medicine and that it has given me the life that I have now, and that there isn't any pharmaceutical that could ever give me what I have now. So
And
I
I've heard,
need that recognition and that respect for what this plant does for me.
yeah,
And that's what I'm looking for. And that's what we have to try to achieve for everyone. So,
I think I'd feel more comfortable if it were to be like on a employer basis where, you know, if you are, you know, maybe asking those questions on the application and like, you know, just making those people aware of, okay, well, if you're not going to use it responsibly, then you're just not going to have a job. End of day, you know, and end of the story. Like, I mean, that'd be fine with me.
well, and Angel will tell you, your mom, that that's not something that you can
I
have. So, you know, again, this is a murky situation and why we're having this conversation, because it is something that needs to be addressed. And how are we going to address it? So, do you have any suggestions of what your company could do to maybe beyond that, Michelle, to bring this to some light about this as medication?
Well, beyond submitting the proposal for a workplace medical cannabis policy, um, I don't know, sometimes the don't ask, don't tell kind of fits in many places too, that, you know, if you're doing good work and things are going well and there's no concern for your actions and what medicine you take. Like, I'm not asking how many times you take Advil in a day, right? And because I still have the same kind of work day, then it should be fine. Um, I think clear policies around like no consuming on the property or the workplace, right? Maybe that's fine. Especially if people do use inhalation as part of their medicine, right? I don't think that that should be left out of um, of consideration. So if there is a policy that's in place, having clear guidelines that you can't consume on the property because we don't want our reputation to be mixed with that. Um, Maybe designated areas where you can, and then yeah, other than that, like I don't think, yeah, I don't think that people need to disclose too much about their medicine regularly.
But when you say they don't want to be associated with that or be known for that, I think employers would get better recognition if they are known for being accepting for their employees using medical cannabis, so that they can show up for work and that they can do their job. So I'm going to go around table and ask each one of you, if you did not have access to medical cannabis right now, and and someone told you you can't have it for a week and you have to show up for work, would it change your work quality and your work ability, Michelle?
Definitely, absolutely, it would. Um, yeah, I would. I, I would be in pain all day long, and I just wouldn't be able to focus. It would, yeah, it would change my day completely.
Shaylee?
I would be spending probably about 95% of my 8 hours in the bathroom. So, yes, it would significantly impact my workday.
And Angel, I know you've retired now and you're not working, but if you were still working, would it have impacted your day, and how would it have impacted it?
Oh, absolutely. And you know, even to this day, and you know, going on to into meetings that we have got, the two of us have got, if I didn't take what I needed to consume the night before to get rest, I can't function, because I do have a very difficult time falling asleep, and I would be in pain and I wouldn't be able to focus. So absolutely 100% it would affect how I would work at an employer's facility or in my own office.
You know, been a conversation that's very been very enlightening, and it has also, I hopefully, given everybody something to think about, whether you're an employee or an employer, or just someone within your family, to kind of understand what it's like for us as patients trying to maneuver this world of being a patient using medical cannabis. We have to, people that use pharmaceuticals don't have to go through this. They don't have to justify their medicine. We do. And so, we're put at that, and we take that risk on wholeheartedly. I think all of us do, and wanting to make sure that we have access, and so does everyone else. So anybody have any last minute thoughts they would like to share before we close out? Angel.
Yes, so I do. So I believe that if we can trust our employees to manage their medication responsibly, we should be able to do the same with cannabis, especially when it's legal and prescribed. The workplace should be a space where people can feel safe to be honest about their health needs. And it's time for policies to reflect the compassion, the common sense, and the current laws. The world is evolving, and our workplaces need to evolve too.
Very well put. Thank you. Shaylee or Michelle, do you have any final thoughts?
I just feel that if you are coming to work fit for duty every day, that that your chosen medicine should be respected, and that the form of medication that you choose shouldn't even come into play if you are doing what you're supposed to be doing and you are effectively showing up for work every day.
Great.
I agree. If I can consume and do my job and 5 other people's jobs and do them well and effectively, then I don't see a reason why nobody else can too.
Mm-hmm.
Yeah. Great conversation, ladies. I appreciate you being here. I think that if nothing else, I hope everybody walks away with a new perspective on how we maneuver this conversation and how we can take it forward. And if anybody has any feedback or comments that they would like to send to us and like for us to address, please do so. These conversations are here to help you understand cannabis as medicine, understand how we engage with it in our communities, in our workplaces, and everywhere that we live. And I hope that everyone has a beautiful day. Thank you. We so appreciate you dropping in. Your time and support are invaluable as we strive to educate and advocate for the transformative potential of medical cannabis. Remember, you have only one health and one life, and no one lives them but you. Let's continue this journey together. Subscribe and hit the bell icon to stay updated on our latest conversations. Your comments and engagement fuel the dialogue we need to create change. Until next time, stay empowered and keep exploring the wonders of your endocannabinoid system.